This is the work that we're doing with our electronic health record. And we've been on our electronic health record for 8 years. And we have a tremendous amount of information in the electronic health record. And never before in our practice have we been able to get into that information and mine it and evaluate it. In most practices, the information is stuck in paper records and cannot be evaluated or mined very easily. But since we've been on the electronic health record for 8 years, now we have a tremendous amount of information that we would like to tap into. And we want to ask a very specific question, and that is, how good is the work we're doing as physicians? And this MinedShare product that you're speaking of basically will allow us to delve into electronic health record and make any type of query we decide to make. We can ask all types of questions. How well are our diabetics controlled? How well are our patients with hypertension controlled? How well are our patients with high cholesterol controlled? Are we doing all the preventative care we're supposed to be doing? These are very, very difficult questions to ask when you ask them of an entire population that you're responsible for. But with the electronic health record and with this particular ability to mine into the record, we're going to be able to start asking those questions. And what we plan to do with the answers to those questions is find out where our gaps are and address those gaps, and where we're not doing as good a job as we think we are and address those issues. Figure out if there are systematic ways that are interfering with good doctors trying to do good work. Because sometimes it's good people doing good work in tough systems that create problems. So we're looking for, this is part of our systematic and our programmatic way to address quality. And we want to weave that approach into the entirety of our construct as an organization. It is absolutely critical. It may be the most critical thing we're doing at Wilmington Health. The ultimate beneficiary of this is going to be the patients, the people that we're responsible for. Because again, this allows us to look at the quality of our work in a very bracing and honest and transparent way, and look and see where our faults are and start doing things to correct them in a systematic way as an organization. For instance, if we start data mining our information and we find out our mammogram rates are 80% of what they should be, and we move those rates because we found that information out to 90% of what they should be, or maybe 100%, we will save a life. So this is probably the most important and critical thing we're doing at Wilmington Health. There are several ways it can benefit a patient, but most importantly, if it improves the work we do as a healthcare provider, then it's going to benefit the patient because they're going to receive better care. They're going to receive care that's more reliant on evidence-based medicine, more at the state of art of care. And so they will benefit because we will be providing the best possible care to them. But also, it may benefit because they're also going to be better consumers of the health care they're looking for. Because as we see it in the future, patients are going to be very discerning consumers of health care. And they're not just going to want to know if their doctors are nice, or if their exam rooms are pretty, or if it's a comfortable place to go, but they want to know what is the quality of the work being given at this healthcare institution. And this is a national trend, and this is a good trend. And we embrace this trend, and so through that type of transparency, we expect and hope that we're going to be able to communicate with our patients telling us, hey, this is what we're doing, and this is the quality of the work we're doing, and we can stand behind it. So when you come to Wilmington Health, this is what you're going to get.